South Africa is a country of contrast because, of course, we have a very high Gini coefficient, meaning that there is a lot of difference between the rich and the poor. It's probably the most unequal country in the world. Based also on that, and also based on the sad history of South Africa and apartheid, it's a country that is very divided. And this can be found also in in the health sector, because you see in the health sector that there are like two countries. One is like the 20% that you would call them the have, and then you have the 80% who are the have-nots. So the have a private medical scheme, as I call it here, or medical insurance. So they pay, or their employer pay, a high premium to be a member of this scheme, and they receive care, very specialized and very expensive, from private hospitals, private doctors, and they use basically 80% of resources. So you have 20%, they use 80% of all the health expenditures in the country. Then you have the other 80%, so the majority of the population, who don't have a proper, or I would say a regular job, or they are not covered by medical insurance, so they rely on the public sector. And the public sector, as I said, uses only 20% of the resources, serving the 80% of the people, and it's perceived of poor quality. In addition, we have to say also that it's a country with what we call the four flaws, or as like a quadruple burden of disease, meaning that you have diseases from poor countries such as HIV, of course, very important in South Africa, biggest HIV population in the world, 7 million people with HIV. So you have HIV and tuberculosis, you have maternal mortality and child mortality. Then you have a lot of chronic diseases related to lifestyle. So you have the most obese population in Africa, the biggest population in Africa. So you have a lot of conditions such as heart condition, diabetes, etc., that are related to the way you eat, how much you smoke, what you drink, as we say, the lifestyle. And the fourth burden of disease is related to violence and car accidents. So South Africa, based also on the inequality and on that I would say difference between the rich and the poor, it's a country that is it's very violent, and there are a lot of car accidents. So the health sectors, both the private and the public, have a lot of on their plate. They have to take care of a lot of patients. They spend a lot of money. So we have used three main instruments to support South African debt. The first one is budget support. So we give money to the National Treasury, so the Ministry of Finance, if I can say, and the Department of Health, so they can try out pilot projects and ways to do this health insurance, how it is. So this has been now from 2011 to 2017. The second way is with the Universal Health Coverage Partnership with WHO and Luxembourg. So there we are providing technical assistance, so people basically go into the department and they look at different aspects when you want to create, a national health insurance for. So, for example, what kind of law you need to change, yes? Then, for example, what kind of relations you want to have with the private sector? Because, of course, it's not in the interest of anyone to cut completely a very developed and, I would say, a very good, in a way, private sector in the sense of skills, capacity, etc. There's a lot there that is very, cutting edge that the private sector is doing in South Africa, and of course we have to take stock of it. It's not like destroying it. It's another instrument that we have as the European Union that can be helpful in South Africa. We have technical assistance called Socieux. So socio means that we use peers in Europe or specialists, people that are doing, for example, national health insurance in their own country, let's say, I don't know, the Czech Republic, France, to name just a few, and they deal with very specific issues of those of that policy there, and they can come to South Africa, and so they can exchange with South African, explain what they do, how they are solving problems, and then the South Africans can decide whether they want to take stock of the experience of that particular country or or not.